Good evening, everyone. Welcome to a meeting of the Councilors-At-Large here in the city of Brockton. It is September 25th. We're very glad to join you. We like holding these meetings because it's important to stay in touch with our constituents and our residents, not just during a political campaign. To my immediate left, I have Councilor-At-Large Rita Mendez, and to her left, I have Councilor-At-Large Tina Cardozo. And over in a corner is Ward 4 Councilor Suna Castro, who was kind enough to monitor Facebook Live for any questions that come in. We'll be presenting some initial information from some guests, and then we'll go to mostly what we hope will be questions so we can provide you with information. So having said that, Councilor Cardozo.
So I am going to introduce, good evening, everyone. I hope you all can hear me through this. I'm going to introduce our Honorable Mayor to give us some updates on the CARES Act and any other city business that we have. Mr. Mayor?
Thank you, Council. Good evening, councilors. Councilor from the Ward 4. I want to first of all applaud each and every one of you. When I was a Councilor-At-Large, I came up with this idea. And it was accepted by the other councilors at large, and it's been very fruitful. And I know last year there was a little bit of a lag, but I applaud you all. In terms of giving updates, let me give a quick COVID update, if I may. Dr. Herman and, of course, Dr. Montesir is here tonight, Eno Montesir, who's the Board of Health Director. But we are still in yellow classification. We're at 6.7. Statistically, 2.27 is the positive test rate. There is a change, and I sent the dashboard to the city councilors, to the superintendent, and to the state delegation. 287 was the loss of life, but it's been reflected, and thankfully it's gone down one because they listed as a Brockton resident. Unfortunately, that person that expired was a long-term resident outside, so DPH has modified that. But we have still at 286 loss of life. We're at 92 active cases. We did pick up 8 new cases in the last 24 hours. Total cases overall, 4,769. And I know Dr. Montesir is here as well today to discuss some endeavors that we're doing. I will tell you that on Mondays and Fridays at 1 o'clock, we have a standing call with all the hospitals, with Sue Johnson Neighborhood Health Center, Father Bill's Mainspring, and Daniel over at High Point. The census numbers at the hospitals are reflecting some positivity, which is really a good thing for the community. Although some of the nursing homes, and I speak to them once a week, are seeing a slight uptick in the seniors that are residents here coming down with COVID. But I think most eye-opening statistic is from July 6th, when Dr. Herman showed us here in the school committee, in this chamber here, in this room, ages 0 to 22 years of age, there is an uptick right now. So again, you all know we're remote. Superintendent Mike Thomas is here to discuss what's going on. We have to iron out some wrinkles. You know, it's frustrating. It's discouraging. I have 3 young kids myself. It's a challenge, but I do applaud all the caregivers, the parents, the guardians, and the teachers right now, but most importantly, the boys and girls. It's not normal. They want to be in the classroom. They want to be with their friends to learn that way, but we have to do it out of abundance of caution and safety. So that's the COVID endeavor, but I also wanted to just touch base with you on the CARES Act. As you all know, the county had received substantial money from the feds, Plymouth County. We did get our first, I'll call it round one of $1 million. But you have to remember that I think $180,000 of that goes to New Heights Charter School because we were helping them get reimbursed as well. Troy Clarkson, the CFO, has submitted 2 additional $1 million total, $200,000 and $800,000 on the city side. Aldo Petroni on the school side is calculating right now. We expect at least $7 million coming in the near future to submit that. And that was most of it attributed to the acquisition of the one-to-one devices that we're using right now for the boys and girls. We do expect to have sizable appropriations back to the county. I spoke to County Commissioner Greg Hanley today and Treasurer Tom O'Brien. You know, we were told when we did, and a lot of you were able to attend that day, the check ceremony at the Neighborhood Health Center, we were told that Brockton is lined to get additional funds. We need the money. We need it drastically. The other component, and I just want to stress this, is that what we would call the third round, although it's rolling, so it's really probably going to be more than that, but the third classification was based on 3 criteria: libraries, veteran services, and then Council on Aging senior centers. So Janice Fitzgerald over at the Senior Center Council on Aging is compiling hers, Paul England to Library, and of course Dave Farrell for the veterans. So, we are working. I spoke to Claire Cronin just the other day. She was on an SBA call with me today. We're working with the state delegation to try to figure out what is the Chapter 70 number. We don't have that hard number yet. There's level funded through October 31st, but the delegation has not been able to, from Beacon Hill, get a hard number yet of what Brockton and other municipalities in the Commonwealth will get. They are waiting to see what the feds are going to do for us. And I will tell you right now, Congressman Lynch feels confident that we will get some additional funds. I did speak to U.S. Senator Ed Markey and Elizabeth Warren. They also believe that Brockton will reap the benefits of some federal funds. Key question is when, and there's no timetable on that yet. So it's troubling, to say the least. But I do know that we will be receiving some additional financial assistance that is needed. The RAF program, and I want to applaud four counselors that attend the Health Equity Task Force: Tina Cardoza, Rita Mendez, Jeff Thompson, and Susan DeCastro. It's led by John Messia, my point person in my office. But the RAF program is being monitored right now by NeighborWorks. Rob Corley is the CEO. There's additional funds for people. Now, we know, and I strongly disagree with what Governor did. He's not going to extend the moratorium. Cities such as the city of Brockton, we need that. We absolutely need that to help people pay their rent, pay their mortgage, and help subsidize that. I know there's a thought process right now, and we had waited a long time to get an answer, a concrete answer from the county. I know this was discussed yesterday. In terms of the city trying to assist, I support that endeavor, trying to assist people in terms of trying to get through their mortgage and their rental. The only nuance of living in Plymouth County is that if we were in any other county, the Commonwealth of Massachusetts has already dispersed funds to cities and towns to do that exact thing, to help pay. They've already done that. What's different here in the city of Brockton, we would have to pay up front, get the paperwork, and then seek reimbursement. So I just called Mr. Clarkson tonight when I was driving over here to get some more clarity. He's on vacation today, but he took my call and gave me some good detailed. So it's a work in progress, but I will tell you from the CARES Act's perspective, they're saying that they want to give Brockton every penny that we're entitled to, and the only really question is timing. If we don't get that money by December 31st, it goes back to the feds. We can't afford to do that. So that's kind of a quick synopsis right now.
Just for the public, would you explain RAFT, what that acronym stands for? It's Rental Assistance Program?
Yeah, it's a rental assistance. It's federal. Yeah, it's federal money. We are, again, CDBG, Community Development Block Grant funds that come in as well, and we're able to attribute those to certain endeavors. One is business assistance, and I do want to make a plea, two different pleas. One plea is the census, 5 days to go. Federal census, federal census, federal census. We got to get counted. Everybody has to be counted. When I left City Hall tonight, we were at 59.9%. Much better than some other cities, better than what we did 10 years ago, but not acceptable. We have to get an accurate count so we get our essential services funds that are going to help our city, our infrastructure, our schools, and public safety endeavors. So, yeah, that's what that acronym stands for, Councilor.
Okay. Any questions? All right. Thank you, Mr. Mayor.
Thank you.
Thank you. Councilor Mendez?
Yes. Good evening, everyone. So I'd like to invite the Superintendent Mike Thomas in. This is a very important topic. It's regarding reopening schools and what is going on. When it's coming September, it's always a stressful time when it's back to school time, but this year is unprecedented, very different time. So we're very happy to have you here tonight. Thank you.
Thank you, councilors, for having me. I really appreciate it. As you know, we started on September 16th, last Wednesday, fully remote. When the school committee voted back in mid-August, we were in the red, and they did the right thing by voting to go fully remote. Unfortunately, we know the burden and the strain that puts on our families with child care, and just simply, it's just not the way to educate students online, fully remotely. That's not how we want to educate kids. That's not how we should be educating kids, so it is very important for us to get kids back into school, to get students back into school. So the school committee last week voted to look at the metrics and we have to be in the yellow for 3 weeks, and then we would work on a plan to bring back our students with disabilities first and our high-risk students, some of our bilingual students and students that are really struggling, that are behind grade level. Those would be the first students that we would return to school in a hybrid model, and then obviously we would bring back other students as a phased-in plan to make sure it's safe. And, you know, it's important that, and I think the parents need to understand how important it is for us to work hard, stay in the yellow, and bring these students back to school. Because there's nothing that can replace in-person learning. It's just, it can't. And even though with the mayor, the city council, the school committee working hard to make sure we got every dime of the CARES Act money, we were able to buy 12,000 laptops. Every student now has a laptop. The older laptops we gave out last year, 6,000 of them, they'll be swapped out this week. So every student will either have a brand new laptop or a laptop that's 1 year old. When you're educating 16,000 students online with 1,300 teachers who are also online, there's just no way that's going to go fully smooth. You're going to have your bumps along the way because of just simply technology. Like the first week of school, we had issues with Zoom, and that was going on, you know, pretty much all over the country. We've upgraded with Zoom. We now have the same services from Zoom that the colleges have. It took us a while to get that because Zoom was pretty much far behind. We still use Microsoft Teams, so we have two platforms where students can be live with their teachers, and you have to have two just in case one of them crashes. And again, there's issues with connectivity at homes with the internet. Sometimes it's choppy, and it's difficult. So we are working hard with families to troubleshoot. We have call centers that are available in all the native languages that we serve. It's important. It's open morning through night. We have parents who have been great. I've been meeting with parents weekly. There's a group of parents, and it was a great idea that came up during our reopening committee to have super users. They call them now champions, helping champions. And these are parents who are very tech savvy, who went through a training last week with our IT department to learn the systems that we use, the online learning system that we use, and they're going to be assisting other parents with the technology needs, and they'll be available for phone calls. We are going to have some in-person training for parents that are really struggling. And so, you know, I'm not going to sit here and tell you everything's wonderful, because it is a battle when you are trying to educate 16,000 students online, and no educator went to school to educate this way. We all went to school to educate students in person, but our teachers, I feel, have done a tremendous job. Right now, we're at about 94% participation rate, and we are calling homes. We're doing home visits to make sure we can reach that other 6%, and we'll continue to do that as much as we possibly can. And we encourage parents, if they are having any issues at all, to please call their school directly, and the principal, the assistant principal, the associate principal will make sure they get the assistance they need. And finally, if a family does need internet access, we have purchased 3,000 MiFi devices from Verizon. They work much better than trying to find hotspots. So the MiFis can be picked up and then brought right back to the home, and it's a little device, and you can hook up, I believe, up to 10 devices on a MiFi. The service is much better, it's much stronger. So again, if you do need internet access, please call the school, and we'll make sure that we get you a MiFi device. We have there's 2,000 in stock. We have another 1,000 coming, and then by the end of October, we'll have another 1,000. So it'll be 4,000 overall just for internet access. And finally, thanks again to the City Council, the Mayor, the School Committee. As you look around, you see our air purifiers. We have purchased air purifiers for every classroom and office in the district. That's 1,800 of them in all, to include, to improve air quality. We have all our PP equipment. We bought 3 cloth Brockton boxer masks for all students and staff. We have plexiglass, we have gloves, we have hand sanitizer, and all through the CARES Act. So I appreciate the hard work of all the elected officials with Troy Clarkson and Aldo Petronio, and how hard they worked to make sure we had everything in place. And We were lucky that we're not a Google Chrome district because we would still be short about 8,000 computers if we were. School systems are having a real hard time getting Chromebooks. We use Acer tablets, and they were available, and we did order these back in pretty much the beginning of May. So we were ahead of the game and were able to get these laptops where a lot of several other districts are waiting for thousands of laptops to come in. But again, it is bumpy, and we're doing our best to support our families, and we will continue to do so. And again, it is important to get our students back into school because that's the only way to learn is in person.
Yeah.
I mean, not the only way, but there's no substitute for in-person learning.
Right.
And we know how difficult this is on working families. Some parents who work 2 and 3 jobs to then have their children home learning online. It's just, it's just not a good experience for parents that have to deal with that and worry about childcare. So we understand that, and it's very difficult. So I'll take any
I
questions.
have a question, Mike,
Sure.
for parents at home. What's the best way to, should they call their teacher or their main number, or if they have any issues or problems, what's the first point?
It'd be
of
direct
contact?
to the main office.
Main
So
office?
there's the main office line. If it's after hours, then there's the tech helpline
Okay.
that goes until, I believe, 9 o'clock at night. But if it's during the day, they could call the school directly, and they will get either the assistant principal or principal, and they'll guide them in the direction. So that's the quickest way for us to serve them.
And there's someone to pick up that line like all day long, or does it go to a voicemail
At the school?
at the school department?
No, it should always go to directly to a person.
Directly,
If it's going
okay.
to a voicemail, then they can reach out to my office, 580-7000. No, none of them should be going to voicemail unless the first few days of school, the lines were really busy. But the main office lines go right to the administrative assistant, and then they'll get the call right to the principal or the assistant principal so they can assist.
Okay, and then one more question. How often are you reevaluating the situation? Is it weekly? Is it?
Every week.
Every week?
So the school committee voted a policy that we would, starting last Wednesday, and I'm sorry, the date, the date escapes me, I forget, the 18th. So September 18th, the 17th, they took the vote. So starting on the 18th, because the metrics come out every Wednesday, so if we are to stay yellow for 3 weeks straight, and that was also the suggestion of the Department of Education, so if you can stay in the yellow 3 weeks straight, then you can consider coming back to a hybrid model in person. So the school committee did adopt that policy. So it would be 3 weeks from this past Wednesday, the 18th. And if we are to stay yellow again, the first group of students we would bring back are students with special needs and also our high-risk students.
Okay, thank you. And thank you for the amazing work that you're doing there. I really appreciate everything
you.
that you guys have done to keep our kids safe.
Thank you.
Thank you very much.
Thank you. Appreciate you having me.
Okay, our next guest who is here, and he and I go back a long way, is Chief Emmanuel Gomes, Brockton Police Department. And I especially asked the chief if he could quickly pull together some statistics on how many calls, types of incidents and calls the police department has handled since January 1st, because I don't think it's well known, Chief, exactly how busy the police department is.
Well, thank you, and thank you for having
Good
me.
night, thanks, take care.
Council, I just want to tell you a little bit. Obviously, this has been a challenging year, I think, for every city department, and especially for the police department. Some unprecedented issues that we're dealing with. Even in these days where we've had some budget shortfalls, we have managed to stay a full-service police department and provide full care of service whenever anyone calls us. Being that, in Brockton being rather busy, we average around 100,000 calls for service a year. That's on average. This year to date, we're around 70,000. Although the call volume is down because a lot of things were shut down, our 911 calls are way up. So we usually average somewhere between 45 and 48,000 911 calls per year. That's what we average per year. As of today's date, we are approaching 45,000, even in September. So with that, those are priority one calls. Those are, and a lot of those calls require more than a one cruiser response. So when I give you the calls, that doesn't tell you how many cruisers were actually deployed. We have some 911 calls that require a 2 cruiser minimum, or it could require the entire shift, depending on what we have. So that's where we're at with the call volume across the city. And as you know, throughout this summer, we had a hot summer. And people were outside, and we had issues at the playgrounds. That was an issue. We had issues with fireworks earlier in the summer, throughout the summer. We have the police department. When I say unprecedented, we never used to get calls for social distancing before. These things are new this year. We've always had loud parties, but what we're not getting, let's say at the licensed establishments, we're getting at private dwellings. So those calls have actually gone up for us rather than diminish. We've been dealing with that, and there are all kinds of other neighborhood issues. Everything from ATVs to loud parties have been right up there this summer. And again, being very hot, people wanted to be outside, and people want to have parties and social distancing. So these are a lot of calls that were generated that we're not used to handling. But on some of these issues, I wanted to share with you that we have been very proactive in moving assets around and moving personnel around as we need it. As recently as today, we moved further traffic assets to address some of these ATVs in the early evening and on the weekends, so we're going to have more staff there. I am encouraging people to please comply with city ordinances, and please comply with the mayor's order, which we obviously have orders also from the governor. I'm asking for compliance and respect for that, to not have police involvement in those kind of things. That would be helpful. We are going to have and have been having extra patrols on a weekend to deal with some of these things. And we also have some detectives that also serve as license agents that are going to be out making sure that establishments stay within the curfew confines of what was asked for them to do. So we have all these things going on, and but with the mayor's help, I do want to tell you that the upside is that with the mayor's assistance and all these budget shortfalls, we're going to be filling 15 positions. The background checks are just about done, and we're actually waiting on the state to get them into an academy. And realistically, so you know, a police cadet goes through extensive training. We're looking at about a 23 to 24-week program. I'm trying to get them into an academy as soon as possible, because I definitely want to have them out by late spring, so they'll be there to assist us when the good weather comes back, and we have some of these issues come again. We're also looking at a cadet program. The cadet program would be for Brockton's youth. I'm looking at it as a jobs program, but also a cost savings matter for the police department. They can assist us with some work that it's not feasible or necessary that a sworn police officer do some of these duties. It would also give us an opportunity to see these individuals with criteria about being a Brocktonian, and gives us an opportunity to see them on a job training and see if this is really what they want. So there's a win-win on both sides of the fence, if I may say. And those people then would seek preference and would have preference on the civil service list. That's how that works. I've been dealing with this with the mayor and the mayor's office. We've completed the packets today, and I expect that all councilors and through the mayor's office will disperse them to them, and we can have a further discussion on that.
That's with the cadet program you're referring to, Chief?
Yes.
Okay, I'm really excited about that. I've been speaking to some community members about that for some time now, so I think if we can make that happen.
Well,
we'd
I
be-
had some of my staff, a couple captains and other people, do a feasibility and cost analysis. And they visited other departments and looked at the good and the bad and how it works. And came back quite favorable. And I think it could become operational here with cost savings to the city. And I can show you that once I have the packet in front of you.
Okay,
Yeah, I think the benefit to that program is you do get a chance to really take a look at someone and find out long-term, because it is quite an investment to recruit someone and train them and equip them, are they suited for police work? Because some people do find that, gee, it's not what I expected and it's not really for me. And this will give you a great opportunity to bring some people in from throughout the community, and they get a taste of what it's like. They get to observe police operations, police requirements, and then make a decision if it's a career for them. So I don't see anything negative about it.
Right. It's going to be, we're going to be able, the police department's going to be able to expand our fences, if you will, and bring, bring some people from the community into our ranks.
very good. So Chief, I just have one question. Thank you for all that you do. It's been a tough year for the police and for all of us, but we appreciate you and we thank you. On top of everything else that's going on, I recently witnessed a pedestrian struck on Belmont, and it's been happening quite frequently in bike, folks on the bicycles getting hit by cars. What are we doing to address this? What can we do? How can we help?
Well, one of the issues, sadly, some of those events are exactly what they are. They're tragic accidents. We do everything we can to address some of the causation factors that would happen with some of those things, like impaired driving. Our officers go out and, we're seeing that cell phone usage distractive, the texting, taking phone calls. I don't have a number in front of me, but I can tell you with some assurance that it appears, at least to me, that half of these car accidents would have been avoided if cell phone or some other distraction was not in play. And that's a serious number. That's a serious number. Today, cars are faster, they're quieter. When the windows are up, you really can't hear the outside anymore. And these are all distractions. A loud stereo is a distraction. And then when you get, we also, on some of the other factors, we try to report anytime we see that there's some street lighting issues or the lights are out.
That's what I was going to say. What do you think about the street
Streets are,
lighting?
right, the streets are out, especially when, city's unique where we have several state roads go through the city. Although the state roads are kind of city maintained, but we have to deal with the lighting. We do have a regular reporting system on that where that plays a role as a causation factor, if you will. And sadly, some of them are accidents, and some of the others, there's a human negligence factor to it that we try to address by having traffic enforcement and other enforcement out there.
Okay, thank you.
Any questions coming in, Councilor Nicastro, or?
There are some, not specifically for Chief Gomes. Not specifically for
Not
Chief Gomes,
specifically.
but we do have some questions.
All right, well, maybe I'll just, I'm going to ask the chief just to talk a little bit about the public safety complex that we're planning, because the police station is grossly out of chronology with what we need now in modern police work, and you've had Captain LaFrance sitting in on a task force, but tell us a little bit about how important that facility will be to you as you embrace all of the different challenges that we now have in police work.
Well, I'm hoping that after we get away from this COVID thing that's amongst us now, I'd like to have the counselors, especially the counselors, come and visit the police station. I've been there for 35 years, and we had outgrown it when I got there. We have changed everything from closets to the room where the heater is into office space, because we have filing cabinets out in the hallway. We really need a facility much larger than that for what goes on in the city. That building came to fruition in 1967, and we can agree that Brockton has grown and changed since 1967. And it's just an old building that, and it's very expensive for us now to maintain that building. It really is. When it's now at an age where it needs some repairs that I think may outweigh the investment. So I'm looking forward to that.
Okay.
All right, well, we appreciate you being here, Chief, and we appreciate all that the men and women do.
Thank you,
These are
Councilors.
tough times to be out on the streets.
We'll get through it together.
We will, we will.
Get through it.
Thank you.
Okay?
Thank
And
you.
thank you, and thank you for your help.
Chief.
Tina or Rita, do you want to introduce Dr. Mondesir and have him come down for a little bit, either one of you?
Sure. Linda?
Now we have a new Board of Health Director here with us, and it's Dr. Eno Mondesir. And it's an honor to have you here, and we're very fortunate in very trying times, and we desperately need you in the city of Brockton. So thank you so much for accepting our offer and being here with us.
Well, thank you very much for inviting me to come, and thank you, Mayor. Thank you, all councilors, for being here. It's a great pleasure to have the chance to meet with you a second time. Although at the councilor chamber last time, we didn't spend a great deal of time, but the city is doing much better. I think the last time I came to this very facility, we were in the red with COVID. Today, we in the yellow, as the mayor has said. So that's some good, that's a hope. That's a good positive sign. But we still don't see the light at the tunnel, at the end of the tunnel yet. So it's going to take a little bit more effort. I know many of our residents are a little bit tense because of the complexity of the COVID, because it just doesn't affect just the physical, but also the psychological, the mental, and the emotional. So it's all involved. So in other words, it's the well-being of the individual and the city that is at stake. And so therefore, I'm hoping that as we move forward, we can not only address COVID, but also address some of the other ancillary issues relating to well-being. Because right now it seems that much of the focus is around COVID, try to stay, to keep it away, using social distancing and wearing this thing all day, all night, sometimes, depending what you do. But I think there is hope for us. The other thing is, how do we address the other issues, social issues? For instance, just yesterday we had several calls, people calling the city to find out how they'll be able to go out in families and celebrating Halloween. Well, I think we still have a few weeks ahead of us. So basically, that's how we at City Hall looked at it, to say we are hoping that by the end of the close to the end of October, there may be still a decrease in the numbers of cases, so that we can possibly say, well, if you need to do it cautiously, if you have to. So a bigger issue, I think, at this time would be, how do people cope with stress? And how many have have experienced depression? Because it's like everything has turned upside down with COVID. And so we are in it together, and I'm hoping that we'll find a way to encourage the city, encourage the residents to do all they can to not just keep COVID away, but to also help themselves in ways that would keep them healthy. And I'm doing everything that I can, being on the job for just a short while to see how I can address different issues. Because, as I said, COVID is one, but COVID is not everything. There are other elements that affect our health as well.
Are you seeing a lot of, getting a lot of phone calls still from folks in the community? I know you've only been there a short time, but how are the phone calls been? Any other issues besides Halloween coming in? Any other concerns, Dr. Munson?
Well, we have other calls because, as you know, the health department handles a lot of issues, ordinances. For instance, just this afternoon, I had to send one of our inspectors out to deliver a letter from the State Labor Department to one of our institutions where apparently they have mishandled the protocol for COVID. So we have many different calls coming. Okay, what do I do? Someone is experiencing symptoms of COVID, or I have someone at work who is sick. So it's a lot of calls, different natures, but many of them reverberate around COVID.
Yeah, it's really the health department. You came in at a better time, I gotta say, because in the beginning it was tough, and the folks did a really good job before you in trying to handle something that was new to all of us. And it wasn't easy. So I'm hoping that now that you're here and we've ironed out a lot of things, for the most part, that we can start to look at a lot of what you talked about. I'm happy you talked about some of the mental health issues around COVID, because we haven't even seen that impact yet, with depression around everything that we're going through with COVID. And, we know that we've had a lot of health disparities and racial inequities that existed before COVID, and COVID just further exacerbated those issues. So we're hoping to tackle some of those. And I'm hoping to, help you out, because I know the community fairly well and learn from you as well, your expertise in the field. So welcome, and thank you for being here.
Thank you so much. Thank you, Counselor.
Doctor, do you get a sense that the state, and I know there are periodic phone calls and Zoom conferences with the state, do you get a sense that the state recognizes that COVID is more than a medical issue? And do you see funding coming, or is there any discussion about helping out in the areas where stress can cause great problems in families, mental illness, domestic violence? Is there light at the end of the tunnel?
Well, your question, thank you for that question, Counselor, and I'm glad the mayor is here. The calls that I've listened to, the meetings that I have attended, they're very good, very informative, but I think they focus a lot more on keeping the virus at a distance. I'm afraid that I don't know if they don't address those other issues enough, or maybe I haven't attended those meetings, but there isn't much emphasis on mental health or psychological health being addressed in those meetings. But I know I am also a minister, a pastor, and so there are other settings where we address them, and I'm hoping that in the not too distant future, these issues can also be addressed and bring to bear, because if we don't address them soon enough, they probably will give us a greater challenge later on.
Well, and this isn't the night to do it, but, if the virus stopped tomorrow, the economic hurt that's been inflicted on people, it's going to take 1, 2, maybe even 3 years to get beyond that, if at all. And businesses, too. Minority-owned businesses, women-owned businesses. I mean, it's just, I mean, that causes a lot of angst and coping skills. Sometimes people have them, sometimes they don't. So that's why I asked the question, but keep us posted. I think it would be something we'd be interested in hearing is if, because we could talk with our state legislative delegation and say, don't forget that component of the disease, that when people hurt, things go off the rails. And that's a real concern.
Yes, thank you, Councilor.
On the Health Equity Task Force that the mayor helped us to establish, we are now starting to look at mental health, and we want to be able to address that and see if we have enough services, what type of support can we get, further support, because like I said, we still haven't assessed the amount of damage that's been done by COVID psychologically to people from being in the house, stuck in the house for months, and the whole virtual learning, all of that is just taking in people losing their jobs, and the illness itself takes a toll on the body. The stigma in our community around the illness is very scary when people hide that they have this illness because of the stigma around it. So there's a lot of work that I anticipate we're going to have to do to tackle those issues. So I'm very glad to hear that's something that's on the forefront of your mind. And thank you.
Thank you, Councilor.
Any incoming questions, Councilor Nicastro, that would be related to the doctor?
There are not.
All right. Thank you, doctor.
Thank you, Councilors.
Okay, you said you had some that were, Councilor Nicastro, you had some questions for us.
I do have some questions from residents. And the first one is, how do residents request that the city consider putting up stop signs or speed limit signs or painting crosswalks? Would either or all of you like to weigh in on that?
Yeah.
We have a traffic commission member right here.
Right, so I think the
Okay.
best way is to go through their ward councils.
Okay.
If they can find out who your ward council is first, and talk to your ward council, and they can help guide you with some of those things, and, get into the traffic commission.
Also, what I wanted to say is that I'm been fortunate enough to become a member of the Traffic Commission. And
Oh, Rita.
Yeah.
that yeah, kind of. So when I was first assigned by the council president that I was going to become a traffic commissioner, I had no idea what that really meant. Well, just putting my name on the ballot and becoming a city councilor, I also didn't have any idea. But that alone, it just opened up my perspective in such a way that I got to meet some very good people around the city. The traffic commissioners, they really care for what they do. They really care for the residents. They really take the request seriously. So once we get these calls, we put it on the agenda, and then we assign them to the subcommittee. And then the subcommittee actually goes out there, and it's a full day. So I really try to clear my schedule because I like to be there, because that's my field trip. I get to go around the city with very knowledgeable people who actually known the city for 50 plus years and knows the ins and outs and everything about the city. So I actually learn a lot. But I also learned that when the residents make requests for a four-way stop sign, that we can't just, even if we see that it's really required, that it's a busy street, that there's been a lot of accidents, there's children playing, we can't just agree and accept it and then go the next day and put them up. We have to go through the state. And then the state sends out the engineer, and then they make a traffic study. And then if approved by the state, only if, that's when they get to put up. So there's a lot that we have to go through the state, and a lot of the residents think that it's our control as a city to just go and put them up, and it's really not. The other thing is with the crosswalks, a lot of times, a lot of the residents, they wish to have the crosswalks, but then we have to analyze how far is the nearest crosswalk, and then also we need to bring in the engineering and do the traffic studies. Also, speed limits. The speed limits in the city, I learned it's 30 miles per hour. But then some neighborhoods were trying to pass to see if we can get some neighborhoods to become 25 miles per hour. But we can't just go ahead and do that. We have to go through the state. But what we do is we put a cautionary in yellow, the speed limit, which is just a suggestions. But then now I'm telling you that it's just a suggestion. So meaning that if, as long as you're driving 30 miles per hour, a police officer cannot really pull them over and give them a ticket for speeding, because the 25 miles per hour in that neighborhood is just a suggestion, is not really that speed limit. So all of these interesting things I've learned, and yes, if any of these requests, we get them all the time, and it's usually a long agenda, and we take them seriously. We actually go out there and speak with the residents and the neighbors, and we listen to their concerns, and we try to help us to the best that we can. So it's been great. I'm actually loving it.
Well, I'm going to call you for Pearl and Belmont, because we need that left turn sign, for sure.
We definitely do those. Those we can do without the state, so that would be great. We can do that.
Belmont is a very busy place, and it's scary, and I urge the residents to please be careful. There's so many accidents on that street, and for folks to please slow down and be careful. We don't want to lose any more lives there. But thank you, Rita, for sharing all that info.
Okay. Ready for another question?
Sure.
Okay. This is a question from a resident about crime and demands for police services. And actually, we know about the recruits coming because Chief Gomes did tell us about it. But I would like to know what all of you think about demands for police services, and are they met? Do you find, based on what residents tell you and what you understand, that they are being addressed satisfactorily, and any other thoughts you may have on that?
Go ahead, Win.
I suppose I should go first as a retired member of the police department. I don't think we're providing the level of service that we need to. I do think we're struggling to provide the best possible level of services, but when someone calls the police, to them, that may be the only contact they have with the department, and to them, it's really important, especially, if your house has been broken into, you feel violated, you question whether you'll ever feel safe again. Some people even sell their house after it's been broken into because their children are traumatized. So I think the city has to continually and slowly build up the police department so that we have adequate traffic enforcement. There are just too many accidents. I mean, it's becoming a joke now. A vehicle hits a building. When I was on the police department, if that happened once a month, it would be extraordinary. Now it's almost once a week. And we don't talk about it, but that drives our automobile insurance premiums. The more accidents we have in the city, the higher rated territory we become, and then that hits our residents with higher automobile insurance premiums, which is not good. So, again, it has nothing to do with the individual men and women. I don't think there are enough people to handle the calls. And I kind of liken it, without belaboring the point, I kind of liken it to calling a doctor. You really need to get in to see the doctor, and they tell you, I'm sorry, but we're booked out 3 weeks. Well, if you're sick, or if your kid's got an earache, or you've got something that's really bothering you, waiting 3 weeks is probably not a good option. Calling the police and then waiting a couple of hours, or maybe being told, I'm sorry, but come down to the police department, fill out a report, we can't send a cruiser. Psychologically, that makes people worry about the level of safety we're providing. So slowly build the police department, emphasize training, recruit the best possible people. I've always been big on psychological exams for recruits. It's not a guarantee, but I do think the complexity of being a police officer now is one where you have to have coping skills, you have to have great patience, you have to de-escalate rather than escalate, and sometimes you even have to say, you know what, I'm going to step back from this. I'm not going to do what I ordinarily would do. I'm going to step back because I either know the person, I know where to find them, or I can handle this a different way. And I think if we do that, we'll have a greatly enhanced police department in greater numbers that can handle the calls that are coming in. And, you know, we've all talked about people calling the police, and unfortunately, sometimes they've gotten someone who wasn't really that friendly on the phone for whatever reason. It's a customer service business. It's you know, we owe our residents a courteous response. If we can't come right away, tell them, we've got a fatal accident working, God forbid, and it's going to be an hour before we get there. But I think that interaction with the public is so important. And
that goes back to training
Yes.
which is, you know, that's how I look at it. It's more of a training issue. The community has changed since you were a police officer.
Yes.
And so it's a different community. So along with that, I feel that officers have to be trained and retrained so that they can get to know the community and be able to connect with the community and chip away at some of those, you know, those misconceptions about police and those, you know, that misinformation. I feel that only the police officers can do that. My brother, who's a police officer, sent me a video last week. There's a gentleman in Boston who goes around videotaping the police officers and provoking them and there's a lot out there to say stuff so that they can capture it on video and get into altercations. And my brother sent me that, and I was like amazed at the amount of, you know, poise and he was so calm through the whole thing, and the patience while this man is going at it with the video to get him to react. So these are the things that I think, one, he came from obviously a good family, and two, the training that officers need so that they can handle those situations, so that they can de-escalate situations safely. You know, they also need to, I feel officers need to be trained in how to take care of themselves. It's a very stressful job. So they need to learn how to take care of their bodies, eat right, exercise. I go to Cape Verde once a year, and if you see the officers, boy, on that beach with the physique looking good, jogging up and down every day. And then here in the States, you know, some of the officers are out of shape, and they're not. All of that, they need to teach them to take care of themselves so that they can take care of others. They need to train them on how to be patient and de-escalate situations so everybody's safe, they're safe, and the resident is safe. And, you know, we have a lot of work, and especially this day and age, and it's just, I think it's doable, but we just have to take a couple steps back and start to take care of ourselves and start to train our minds and our bodies so that we can handle these situations. As a nurse, I'm presented oftentimes with people who come in and they're, you know, cursing and they're demanding. I've worked for Boston Medical Center for a long time, and we have all sorts of people come in with complaints, and I have to oftentimes check myself and say, hey, take a deep breath, step back, and learn how to de-escalate those patients so it doesn't get out of control. So I think it's training. It's a lot of training and taking care of, you know, ourselves so we can care for others. So.
And I was going to say, I would say to that resident, we're very lucky to have Chief Gomes. If someone really has a problem or someone had a problem, they can call his office, and he's very responsive and very sensitive to how important it is to have that positive relationship with police officers and the public. I like his approach, I really do.
But then too, the folks who answer the phone, like you said, when that first point of contact, they need to be patient and calm,
Yeah.
because oftentimes, you know, whatever the resident is going through, only they know what they're going through, and it's important to them, and it's an emergency to them, and they need to have someone that understands that, you know, this is something that's important to them and know how to handle it right there. Oftentimes that first, and it's a lot of pressure on folks, because I've worked in a call center, the very first person to pick up that phone, they can help that situation right then and there before it gets, you know, turns into a worse situation if they have the proper training, so.
And what I wanted to add to that is that we're a city, so because we're a city, we have city problems. So the police department is so busy with all the crimes and things that happens in the city, that we're really short with the everyday tasks, like the loud parties that happens, code enforcement, speed, and the traffic enforcement, just those smaller things. So a lot of complaint that I hear as well is that they call the police department, and if it's something smaller, like they're dealing with so much that if it's just a loud party, maybe that's going to get down on the list. So I'm very happy that in our last council meeting, the Chief Combs did state that he wanted to put that higher in the priority, because a lot of residents, they're calling, and it takes, by the time the police gets there, then it takes hours. So now, just by putting that up higher up as a priority, then hopefully it's going to address that situation. But just those smaller things that we don't realize that we need the police there, because then if the police is there, maybe it's going to prevent the bigger things from happening. Like the loud parties, sometimes we have disasters that happens in them and shootings. If the police gets there in time and disperse the public and the people now, especially with COVID, so we desperately need police officers to have this time and ability to be more vigilant on the smaller things, just to prevent the bigger crimes from happening. So I'm looking forward to the new officers that are getting training, the academy, the cadet, and all the different things that are coming along. And we as a city working together, residents picking up the phone and calling when things are happening. The dirt bikes, they seem to be constant on our neighborhoods, and then by the time they complain, it's gone and we don't know what they are anymore. So maybe just calling right there and then when it's happening, and hopefully at some point we'll be able to stop them, because the word spreads. Once we stop wanting to, then they're going to tell the other friends, and then the other friends will possibly just stop. But we have to start addressing these smaller things, and I'm pretty sure that's going to help prevent the bigger crimes from happening. So.
And then maybe Wynn can speak to when officers do go to these parties, what they're able to do or not do, because sometimes I think that when residents do call, they think that the officers can go into the home or they can break up the party like immediately, and sometimes they are limited in what they can do. Can you speak to that, Wynn, as a...
Well, they are limited. You just can't walk into someone's private residence without being invited or receiving permission, or if you have a warrant. So you go to a loud party, the first thing you do is listen, and it was always my experience that 9 times out of 10, if you went up to the person who was organizing the party or who owned the property and said, look, we've got a lot of complaints, and let me back up a minute and say, police officers, our peace can't be disturbed. It has to be a legitimate complaint from someone else. But they'll work with you, and I think the loud parties we've had recently is a lot of pent-up frustration over the virus and limitations on dining out and limitations on bars being closed, but that's no excuse. We've got to treat each other with respect and dignity and not have loud parties that could affect young children or a terminally ill person who lives next door. But the police are limited. The first line of approach is to ask for cooperation and understanding, and then if that doesn't work, the next line would be to, unfortunately, summons the person into court for a complaint of disturbing the peace. And I believe I heard the chief say there were about 5 pending complaints because of loud parties. People will have to go into court. They'll probably have to hire an attorney. And that's too bad, because just cooperate. Think of how it would affect you. And Tina, you have nurses at the hospital that work all kinds of crazy hours. They need to come home and get some rest. They don't need a professional sound system blaring next to them. So I think we're doing okay, but again, I think more police officers trained to interact with people and de-escalate situations could go a long way towards solving the problem. And hopefully we'll get there. The new 15 recruits will certainly be a big help. And the cadet program will too.
Okay. Over the summer, Brockton's positive COVID-19 case count increased greatly. and we went into the red zone. And the mayor was forced to impose a citywide curfew from 11 p.m. to 5 a.m. except for essential travel. Okay, here we are 4 weeks later. The city's positive case count has decreased, and we're now in the yellow zone. But the city COVID case count remains among the highest in the state. How should the city proceed from here as to that curfew?
As to the curfew or in general as to the cases?
I'd say both.
I think that, you know, we need to look at it, and I think that we need to get the advice from the folks, our Dr. Herman, our Board of Health, to see if it's in fact being effective. I think I've always thought that the better plan was to educate them all about education and sending out information in different languages. Initially, when we first got hit with COVID, I felt that we could have done better getting information out to our residents in different languages, and I pushed for that, for us to do that. People had so much misinformation around COVID-19 initially, even the CDC, you know, so every day it changed. And so I think with our residents, we all know that there's challenges in this city getting information out. We have the wonderful Brockton Community Access. You know, we have our enterprise that shares information in the paper. And then we have some radio programs that share information, but still, we still have a big problem getting information out to our residents. And so for me, I don't know if the curfew 11 to 5 is more important than getting information to our residents so that they know how to stay safe, how to stay home when you're sick, how to get tested when you feel you need to be tested, how to not, you know, gather at large gatherings, wear your mask, wash your hands. We still have a lot of that I feel is not getting across to people. And the stigma that I spoke about a little while ago in some of the cultures around illness, they don't take illness well, especially contagious illnesses, that they feel, you know, let me hide this. I can't share this with anyone because if they get it, they're going to say I gave it to them. So there's a lot of that exists in the community that we need to tackle. And I think that's more, to me, more important. The businesses who are they're going through so much. Our restaurants, they got hit really hard during this pandemic and had to shut down for a long time, lost a lot of money. And now for them to be hit with the curfew, 11 o'clock, is really even, like, it's a double whammy. It's hard on them. Out of no fault of their own, you know, they're being asked to send everybody home at 11 o'clock. I think more importantly, breaking up some of the larger gatherings, sharing information in different languages, continuing to test people, continuing to chip away at the stigma around COVID-19, to me is a better plan. And we're going to have to do that long term, you know, but imposing a curfew that impacts our businesses is a bit unfair, in my opinion. So I hope that we can reevaluate it soon and help these businesses to stay open a little longer, especially on the weekends, so that they can start to make some money. You know, they pay taxes. It impacts the whole community when they can't make a living. So that's my opinion.
Counselor?
Yes, I think it will be similar to what the school superintendent has stated, that they are evaluating the situation on a weekly basis, and then at that point make a decision. So I think that's how we as a city should be doing the same, evaluating the situation on a weekly basis, getting in touch with the pandemic consultant and see what the professionals and the doctor that was just here today, Dr. I can never say his last name, but it's Monsignor, but I'll learn it. But yes, just like how he stated, it's the overall well-being of the people. So it's psychologically, so it's emotionally. It's a lot that the city and everyone is going through already. And then putting in a curfew on them, and we've already been put through so much. But then that has to be a decision that it's been done by the mayor and also the professionals that is going to be guiding the mayor, but also evaluating that on a weekly basis and just assessing the situation. Just like how it was stated, our numbers is still high, and I think at this point our goal is to make sure that everyone is safe. What I really like is the parks that are being closed from 4 o'clock on. I think that
Yes.
is great because there's a huge gatherings at the parks and public. So those things, I think it really is working. So, but it's overall just getting those who knows best, who's studying the numbers, seeing the whole thing, and just evaluating the situation, and looking into the restaurants and the business owners, because they've already serving the public on an unlimited basis, and they had outdoor dining, but now we're getting cold weather's coming, so they're already struggling. And also to demand that they send the public and their guests, their customers home at 11 o'clock. So everything needs to be put on a scale. It's not a yes or no answer, and it's not anything that we as councilors can say, because that's the whole discretion of the mayor. And I believe that he's getting his advice from the professionals. But I think overall, just evaluate it, assess it, just like how Tina said, how beneficial that is being overall, and also continue to educating our residents, telling them, making sure they're wearing their masks and washing their hands and doing everything that we're being told to be doing from day one. And hopefully we all can beat this whole thing together. But it's been challenging for everyone,
Terribly.
in very challenging times.
Counselor?
The curfew is tough. I will tell you that, for me, the most important thing is holding the numbers down and getting the kids back to school, because that affects so many things. Parents having to take time off from work now to be home because the kids can't go to school. But you've kind of got to let the science drive the whole issue. I mean, if the number of infections go up, if the positivity rate is up, then you really have to look at all of your different options like masks and curfews. I'm hoping that we'll get to a point where schools open up next week. As I understand it, you'll be able to sit at a bar, although spaced apart, and food will be served. Now, that's kind of an experiment, and I don't mean that in a negative way. We're not using people as guinea pigs, but that's going to tell you what will the effect be if we start to open up even more and have businesses open and try to go back to normal. So I don't like curfews. I'm sure the mayor doesn't. No one likes to hurt a business. But if the science is telling you that there is still a problem, then you're backed into a corner. You've got to do everything you can to address the number of cases and prevent tragedies. I mean, good Lord, we've lost hundreds of thousands of people in this country, and the prediction today was it go up over 300,000 by the end of 2021. We're in a mess. People travel. You know, it's not just the people in Brockton, it's salespeople that might come in here and stay, and they've got an appointment in Boston. Where did they come from? Did they come from a state with a lot of cases? So we've got a very mobile public, and hopefully that doesn't hurt Brockton. But the curfew's tough, but I think the science demands it right now.
It's interesting that in the month since the curfew was imposed, the numbers have come down in this community. I'm sure it's more than just the curfew, right? Because strides have been made by the task force on education, certainly, but it just seems like all these things have to be in play until we get it to a certain point. But I'm just glad I don't have to make that decision.
Right, but they do have to be reevaluated, and communication is key. I
Yes.
mean, you don't want your business owners to get upset and start to, rebel and protest. That's not the situation we want. We want to work together.
Positively not. That's
And we
right.
want to communicate better. So I think reevaluating, giving feedback, and that's why we're here tonight as council folks, it's been tough for folks to reach us. And folks have been busy and stressed over the the pandemic. So we want folks to know that we're here, and we're trying to communicate as much information as possible to them so they know, you know, what we're doing for them, how we're representing them. So I urge folks to reach out to us. Our emails and phone numbers are on the city page. We all have Facebook. We asked folks to submit questions prior to this. Maybe there wasn't enough time, but I'm hoping that we can have another at-large meeting before the end of the year, where we can maybe have some folks come in, social distance, and maybe open to the public, hopefully, if the numbers stay down. But the whole point of where we are today in this country in general is we need to communicate better with each other. Sometimes you can mitigate situations if you just have good dialogue. And so that's why I'm glad that we're here. And I thank you, Councilor Nicastro, for moderating.
That's kind of how it turned out.
You're doing a good job.
Okay, so COVID-19 has hit residents and businesses hard. Residents have lost jobs, and many are struggling. But even before COVID, we had a lot of struggle, okay? And so this resident wonders, is the city doing enough to attract new businesses to provide jobs for our residents and revenues for the city?
Do you want to take that one, or do you want me to?
Well, you've heard me preach before at a couple of meetings.
Right.
I really think we do need to focus, you know, continue what we're doing on housing now, but we need to back off and focus on job creation, bringing new businesses into the city, maybe creating some opportunities for new industries that will emerge because of the virus. We need jobs for our young people because they go to high school and they need to save for college, or they're at Massasoit, or they're at some other college. And I just don't hear that discussion. So for me, yeah, we need to emphasize jobs more. And we've got vacant buildings. You know, we've got city-owned land. If we put a couple of parcels of land together and offered it to a business, maybe they'd move from where they are now, paying exorbitant rent, and create a business here in Brockton. We have 3 commuter rail stops. We always talk about creating housing so people can hop in the T and go into Boston and work. I'd rather create businesses and use the T to have workers come down here and have jobs, and have our residents have an opportunity to work. I'll tell you this, colleagues, there are thousands of people in this city who are going to lose their job, and they're not going to get them back. Because they've been permanently laid off, their unemployment is going to run out, and I have an awful lot of feeling for them. And it's coming at the worst time, holidays, winter time. And so I'm worried. And I can only imagine if I were in that position, how would I pay the bills? I mean, I have a pension. Let's be honest with the public. I have a pension, and so I'm going to survive. And then I have a part-time job, which I do for fun, but it helps. We have people that don't have that, and they need food, and they need clothing for their kids, and they need to pay their bills. And if this city doesn't start creating some jobs, they have no shot at making it. And I'm not trying to be dramatic, but that's the way I feel.
Yeah, definitely more economic empowerment situations, and our, you know, we need to work with the business. I've always said we need to work with the businesses we have. You know what I mean? We have a lot of homeowners and a lot of business owners that need a lot of help and support. And maybe those business owners can, you know, if we work with them, they can create more jobs within their businesses if we empower it and help them out. So there's a lot of work to be done. All I can say as far as like the developments coming in, more communication again with residents, you know, more transparency in what we're doing. We're starting to do that. We're starting to do some presentations around the developments that are coming in and encouraging people to join and pay attention and give input. So I'm encouraged by that. But we need to do more of that, because you don't want to bring people in and then have the residents not know, and then, you know, they get upset because it's going in their backyard and all of that. So we need to continue to educate more around what our plans are for the city. moving forward.
The reality is that businesses are closing, and a lot of them will not be able to survive, to come back, to reopen. So yes, I agree with Councilor Farwell that there are people that are going to be really struggling just to simply be able to put food on their tables, because it's absolutely so hard to find jobs. So our goal, we need, as councilors, as leaders in the city, along with the mayor and the different departments, to market the city of Brockton and to invite more businesses to come in. Yes, we see all of these developments, and they mainly housings, apartments, but I also would like to see businesses wanting to come in and invest in the city of Brockton. And we're a city with 100,000+ people, and I'm sure that there are good businesses that we do really well in Brockton, and it's up to us and to work with the department, the planning, and all the different departments to making sure that we really market the city of Brockton, and we invite these businesses to come in and to invest in the city, so that way we'll be able to provide more jobs for our residents, more jobs for our residents. And we have all the marijuana shops opening up, and they promised us they were going to hire the Brockton residents. So, but at least they're not going to be able to really generate as many jobs as we would like the bigger companies. And we also have possibly the biotech, what came before
Life
us
science.
over, that we just had the presentation as well. If that all passes, and if we find a spot, and there's so much ifs and ifs and ifs, but at least there's something that gives us hope. But we have to be doing more and more and more, because out of all of these plannings and these projects, not all of them come to fruition. So the more we have it, the more likely we'll be bringing business into the city. So yes, we have to do a lot more work, and that is our challenge, that we have to keep working at it together.
By the way, I have a favor to ask of my colleagues. I just remembered, we have a resident whose name is Kelly Hanlon. I'm calling her out because she's always involved along with...
She's not my friend.
Mama P and a few others, but she
Love you,
said,
Kelly.
don't forget the census. And that really, and our colleague, Councilor Rodriguez, has emphasized the census. We've got to get that done, because it's an inaccurate count will really cost us for the next 10 years, hundreds and hundreds of thousands of dollars. So I was going to put my colleague, Councilor Cardozo, and my colleague, Councilor Mendez, under the gun and say, perhaps in a bilingual way, you could remind people to fill out that census form and get it in, because it's important. So I've done it in English, so now I'm sending it over to you folks.
Yeah. So let me ask, Councilor Castro, do we have any other questions?
I have two questions. It could be a lightning round. We'll do them quickly.
Okay, and then I will do that,
Okay.
Councilor Farrell, once we're done with the questions.
Okay. So the first one is, I know that you wouldn't be doing these jobs as councilors at large if you didn't love Brockton. What about the Councilor-at-Large position do you enjoy the most?
What do we enjoy most about it?
Most, yes.
I guess it's just people. I mean, it sounds simplistic, but if someone calls you and they've got a problem, maybe a silly thing like they need a stop sign, or they need more police patrols in their area, when you're able to help them, there's just a great deal of satisfaction. I mean, it's as simple as that. I can't think of anything better to say.
So I came at this resident door, and I knocked at his door because I was campaigning for someone else. He looks at me. He says, "You're that lady from the city." I said, "Yes, I happen to be. Yes, exactly." Oh, I called the city, and I'm still waiting for them to call me back because I need a guardrail, and no one called me back. I said, "Really? They're very good in reaching out, but I happen to be a traffic commissioner, so I will reach out and see what happened." So I did reach out. They apologized. They said they did receive the message, but the person that handles the call was on vacation. And then I put it on the agenda. The following week, we were at his house, and now it passed, got approved, and we're already working on his guardrail because it's a very busy intersection. There's a lot of accidents. It really needs it. But he was so happy and delighted that someone actually listened to his concern. And this is just one example of many. So just being able to really making a simple phone call and being able to help people, I think that is very rewarding, and I enjoy it a lot.
Yeah. And even when you can't help them, just listening, right? Just listening, sometimes they just need someone to listen to them. And you can't promise them that you're going to, work miracles, but you're going to do your best to reach out to department heads and different folks and just kind of plead their case, whether it gets done or it doesn't get done, or whether they get the outcome that they want or not. I think people really appreciate that you tried to help. And so that's what makes it good for me. And then also, we just have such a great community. I thought it was great before this, and now I see how really great it is. COVID-19 just brought out the most amazing people. I actually was going to shout out some people if we had time, but just people pitching in to help deliver food. I had a gentleman who was bringing pet food to the elderly because they couldn't get out to feed their pets. People delivering diapers and hand sanitizers and sharing, hey, Walmart has this now. Oh, I just found this at Target's, on Facebook, so that people can get the items that they need. It's just a great, it's a great community. You hear a lot of the bad, but then when you're deep in it and you see the good, it makes this job worth it, so that's why I like doing it. It's frustrating, it's not easy, but we just have such a great community of people, great activists, great organizations that are pitching in to help people, and I really saw that during this pandemic, and I really want to thank all of the folks that pitched in out of the goodness of their heart, whether they had an organization or they didn't. Some people were just, concerned citizens that just wanted to help. And you saw a lot of that during this pandemic. So that makes it worth it for me.
Okay. And the last one. In your opinion, two of the greatest strengths of the city are?
Win Farrell.
No, school,
He's the tallest.
school system always has been
Yep.
the gem of this city through the most difficult times. And then I would say the people who live here. I mean, you've got everything from finance people to scientists to educators who work in the colleges and universities in Boston. So if the true demographics of Brockton were known, I think people would be astounded.
Yep.
Absolutely, the people of Brockton are the best, but I absolutely love the DW Fields Park. I really haven't seen one like it, and everywhere that I go and I travel and I go to the woods, and it's just beautiful, beautiful, beautiful. I really think more people need to find that park and take some walks around it, because it really takes away all of that stress that we carry, and it's just beautiful.
Yeah, you got to drag me to go. I haven't walked the whole pandemic. But I just echo what I said before. It's just the people. We have great history, great culture, great people.
Okay. We had one comment hearkening back to when we were speaking about public safety, and it is that Brockton police are trained. They are not Boston. Our officers have control. So I pass that on to you, and at this time, I hand it back to you to close your meeting.
Yeah, it's been a pleasure to be here. Now it's up to Tina to give the census message.
Can I just give a shout out to a couple folks? The Brockton Interfaith Community, Mutual Aid, the churches, the Cape Verdean Association, all of the different organizations, the Y, the Boys and Girls Club, everybody that's pitched in during this pandemic to help our families and our youth. We thank you very much, virtual learning. A lot of folks are pitching in to help parents. And just, like I said, there's just been an amazing outpour of support from the radio stations, sharing information, people doing Facebook Live, sharing information. And that's what makes us a great community. I want to shout everybody out there help. And then the folks that are staying home, washing their hands, using their masks, doing everything that they can to stop the spread of COVID, we should shout them out. We're always pointing fingers at the ones that are, throwing large parties and everything else, but the majority of folks are doing the right thing, and we want to thank you for that, to stop the spread. And for folks at home, please do your census. Please register to vote. Please vote, because this is a crucial, crucial election year. So I want folks to do that. I'm going to say it in Creole. Nós fazemos, nunca se vai dizer muito direito. I really can't even say the word. Fazemos census, nós registra, nós vota. Por favor, fazer census e registra para votar e vota. Obrigada.
So I will say it in Portuguese and Spanish. I'll try the Spanish one too. Todos vocês que estão me ouvindo, por favor, nós estamos na última semana para poder estar fazendo os censos. Make sure, tenha certeza que vocês possam estar preenchendo os censos. Não esquece. Por favor, a todos que estão nos escuchando, que puedan hacer tus censos. Es muy, muy importante que preencha tus censos. Thank you so much, and it's been really a pleasure being here, and I hope that it was helpful to the residents and everybody watching us.
Thank you.
Thank you and good night.
Thank you all. Thanks for watching.